So this is a first-in-class, first-in-human phase I study. And as a way of background, really, the concept is based around oxidative stress. This is a hallmark cancer. If you take a cell and you transform it with a gene like KRAS, for example, what this does is increases the amount of reactive oxygen species generation. And as a consequence, these cells have to have a commensurate increase in their redox or oxidative stress defense. And so actually quite vulnerable to increasing oxidative stress. What the RSO-021 drug takes advantage of this vulnerability, not just in mesothelioma, which is an area of interest for me, and was important in this particular trial in terms of the numbers of patients, but relates really to many cancers that have been studied. And so what this drug does is it actually inhibits an antioxidant defense that's within the mitochondria. These little energy factories have very limited oxidative stress defenses, and peroxyredoxin 3, or PRX3, the drug target, this is essentially knocked out or inhibited by the RSO-021. It forms a covalent dimer of the two PRX3 molecules, essentially inhibiting it. What happens then is that the cell cannot, in the mitochondria, essentially stop the production of reactive oxygen species, and it's damaging effects. And this has a lethal consequence. You can see this in cell lines. We can see it in animal models. We can see it in human explants, actually, little bits of tissue which we can treat ex vivo. It's quite consistently showing activity in these tumor models. And so this trial really looked to evaluate this in patients. What we did is we gave the drug, RSO-021, intra-pleural. Now, intra-pleural administration is a bit unusual, but diseases like mesothelioma, some lung cancers, can be localized in this region. And we just published a review, global consensus around the use of the pleural space and leveraging that for therapeutics. So this was given on a weekly administration, and patients could receive this until disease progression. And what we found in terms of efficacy is that this is a drug that appears to be active. We had one patient who had a partial response. We had around 80% disease control, the best response in patients. And a very intriguing result, actually, in terms of overall survival. Now, we appreciate this is a small cohort, about 15 patients in total. 80% of patients were mesothelioma. We had one patient with colorectal cancer, two with non-small cell lung cancer. So quite biased towards patients with mesothelioma. But the average sort of receipt of previous therapy was actually 4 lines of therapy. And we didn't really reach the median overall survival. So there may be something going on here in which we may be seeing change in the natural history of this drug. We have published some data at World Lung last year showing that PRX3 inhibition seems to be able to biochemically reverse the process of transformation to sarcoma towards aggressive mesothelioma. And so whether that is playing a role in this sort of extended survival in these highly pre-treated patients, we don't know. But there's a phase II ongoing. We had the trial in progress poster at the conference as well. And really look forward to seeing what we see in expanded cohorts, see if this is a signal is maintained.